Once again, Dr. Stacey Brown, welcome to All 92.5 the Sierrawave. Well, when we met last time, we were talking about, well, not the hypothetical, the inevitable time when COVID-19 was present in our community. Now it's happened. So tell us what's going on.
Exactly, Bill. We were in kind of surveillance mode for a long period of time. We set up the drive-in testing at the hospital district to really get a finger on the pulse of whether COVID was in the community or not. We did know that we were at risk because last time we talked, it was kind of above and below us, right? There was one in Reno as far as a focus, and then one down in LA. So we knew it wasn't going to be a matter of if, it was going to be a matter of when.
Right.
So as we talked about last time, the workflows that we put together were really designed towards surveillance and trying to find cases and intervene kind of early. In the meantime, we had some great initiatives from the governor and locally to try to limit the spread and what we call flatten the curve. To decrease the amount of cases so that we wouldn't be overwhelmed in the healthcare sector, so that we could kind of like deal with a little trickle of cases that were sick over time instead of a big wave. And so part of that was the containment. Now we've got our first positive case in Inyo County, a Bishop resident that really basically just had, cough and a little bit of some kind of flu-like symptoms. So it goes to show you that that COVID-19 isn't about just ventilated patients and critically ill people in the hospital, but just our kind of friends and neighbors that are out there with some flu-like symptoms. That's been, obviously a wake-up call for all of us, and now we know that this is, a community-spread illness, and surveillance now is kind of a moot point. We don't ask about, travel to China anymore. We don't ask as much about whether you were next to a positive case. So we kind of assume that these are suspected COVID illnesses out there that are fever and cough, sore throat, and the like.
Shortness of breath.
Yep, shortness of breath.
Because I had the flu a few weeks ago, and that seemed to be one of the big determining things. I didn't have the shortness of breath.
Yeah.
So,
and we still have influenza in town. We diagnosed 2 cases this week. So we still got a little bit of some flu. We have something called Respiratory Syncytial virus. That's RSV. Usually happens in the kids, but again, kind of a respiratory illness that can kind of confound or confuse matters a little bit. So it is still helpful to try to kind of test for these things, rule them in, if you will. Again, I haven't seen so many happy people to say, I've got influenza. I'm real happy about that. The COVID can come in a lot of different ways and shapes. So it's important to know that, yes, it's in the valley. It's in Bishop. We have community spread, and we need to do the same kinds of things that we were doing before, these containment measures. People ask me, okay, we've got our first case, what should I do differently? And I say, you're doing the same damn thing, right? You're doing social distancing, you're staying away from sick people, you're covering your mouth when you're coughing, you're washing your hands, you may wear a mask. So I wanted to let folks know and out there that if you see healthcare providers or somebody delivering your groceries or your package and stuff and they're wearing a mask, they're just containing, right? That's good practice. And don't freak out if you see somebody wearing a mask. They may not be infectious. They're just doing the right thing for trying to contain this and slow down the spread.
well, hopefully if they're wearing the mask, they know I'm not infectious. They're asymptomatic. And I mean, I work in a radio station. I've got 2 masks right here that I borrow.
And I took mine off for the interview so you guys could see
I
me.
appreciate that. But I borrow these from NIA, so I'll be sure to give them back.
Yeah, we're good, yeah.
So the surveillance you were doing, the drive-through clinic, is that continuing?
Yes, so it's not that we haven't, that we are stopping doing our surveillance testing, because testing for COVID is important in some very specific cases. We may not be doing quite as much testing in the general population to look and see if it's here, because we know that it's here. But really the testing that we're going to be doing is if we're going to be changing management, or if it looks like we're going to be watching these folks a little bit closer. So testing will continue in places like the hospital, the emergency room. If it looks like a healthcare worker is exposed to COVID, we want to make sure that they're negative on their testing before they go back to work to take care of the next sick person. Jails, correctional facilities, high-risk things like nursing facilities, like Bishop Care Center or Sterling Heights. Those are more specific areas where we would continue to do testing on suspected cases because it has a big impact. So we'll probably end up doing maybe a little bit fewer tests out in the public because we know that it's around, and really do selected testing on the people that it might change their management.
Very good. So we're going from the surveillance to containment. You kind of touched on it, but what should people be doing? There's the theory, but I guess the main thing is just we actually need to do it now.
Yeah.
We need to stay home. If you're not feeling well.
Yep. All those kinds of things. So, washing your hands with soap and water does great. If you have hand sanitizer, great. Just those respiratory droplets don't like soap and water. So good hand hygiene, washing down those high-touch surfaces. So if it looks like you have a countertop where the kids are running their fingers on all the time, you want to wipe that down with a little sanitary wipe or a paper towel with some disinfectant. You're going to want to notify your primary care person if it looks like you have some fever and some respiratory symptoms, a sore throat, and kind of keep them posted. Keeping folks about 6 feet away, this kind of social distancing. The respiratory droplet and the virus just can't get that far very easily just by sneezing. So I always think about 6 feet is about the leash length if I'm walking my dog. So if you're thinking about walking your dog on a standard leash, those 6 foot interval is a good one to think about. Staying away from sick people, right? So staying inside, staying out of big groups. Now's a great time to do those social distancing things on social media, or Zoom grandma and talk to her that way instead of going over to the house. Those kinds of things we've been talking about, and if you're not doing those, now's a good time to do them because it's definitely out in the community.
I was recently at a local big box store. Well, I was at Vaughn's, and they were letting us in one at a time so that we could be distant, but we were crammed together up against each other in the line.
So
So now they've taken steps now. They're spacing us out more.
If you've been there recently, you know that they're controlling the lines and just allowing one person in from a tape. We've done the same thing at the district's cafeteria. So patients and staff still need to eat, but we've got little tapes on the ground so that it's a one serving, and 6 feet later is another person, and 6 feet after that's another person, and we're doing them in sequence. When you go and you get your food, you're going to be 6 feet away at the table or eating outside, right? So those kinds of small things can make a huge difference. And again, if we can slow down the spread of this thing, then our healthcare system isn't going to get overwhelmed with a whole bunch of sick people all at once. And that's what's called flattening the curve.
Because Northern Inyo Hospital has how many beds?
We're licensed critical access hospital for 25 beds. The nice part about what we've been doing in the district, so the listeners know, is we've been planning almost nonstop for the last week and a half on trying to keep ahead of this and make plans for how we deal with sick people and different phases. Right now, since the last time we met, we have a triage area separated in the emergency department, kind of a corollary, if you will, to what we did in the drive-through clinic by keeping those sick folks or potentially sick folks sequestered outside instead of bringing them inside. The emergency room has a room we call the big room where we can evaluate folks. In the hospital, we've been really looking at the supply of respiratory equipment, both respiratory techs and ventilators. Ventilators are always making a big news right now, but we've got ventilators kind of like waiting and on standby if this thing gets any worse.
And most of the listeners know I hurt my knee, so my physical therapy has been canceled. So how's it affecting care at the hospital?
So what we've done is, as we mentioned last time, we were planning on postponing what we call non-essential visits. And so, a diabetic quarterly visit where nothing's really wrong, that would be a non-essential visit during the pandemic. If it looks like you cut your finger with a skill saw, we've got to do that. That's an essential visit. So each department, both the imaging and lab and infusion, the operating room, the clinics, all of us have been tasked to figure out what's an essential visit versus a non-essential visit. Those non-essential visits, we're kind of pushing forward, keeping track of them so that we can come back to them in the future when we have the all clear message, or we're going to talk about televisits in a second, if we can do them remotely while persons are at home, or whether we have to do these things in an essential fashion, a broken bone, a bad gallbladder, an appendix. Those are the things we're going to need to do. So adjusting your focus on which of these things that we need to do that are essential and non-essential. Televisits, I'd like to make a plug for, if it looks like we're doing what we're supposed to and being at home with doing home isolation or even home quarantine if you're a suspect case, is that we still need to be able to reach out to you as a healthcare agency. So we're piloting tomorrow actually some telehealth visits where you'll use your smartphone or your tablet or your computer that may have a camera on it, maybe a phone in addition to something visual that we can end up reaching out to your home and being able to complete that visit remotely. That's what we're calling the telehealth visits, and that will be across a lot of the outpatient clinics, the rural health clinic where I end up working, and maybe rolling out to other places too. Hoping to have that kind of up and running by maybe the end of this week, so we can work on those non-essential visits that are postponed, that people still need their refills or talk to the provider about something, or maybe an essential visit that is self-isolating at home with a little bit of a fever and a cough, but don't know whether I should call my provider or not. I'm just not sure. Do I go back outside? Do I not? This would be a great mechanism to handle those kinds of things.
Outstanding, very forward thinking. Now, is this something that might continue? The telemed?
I would hope so.
Me too.
Really, I'm hoping that this pandemic has really kind of mobilized and pushed us forward into the telemedicine arena. We've been kind of dipping our toe in the water for some period of time, but this was give us a real big push in the back to kind of move forward. And I'm hoping that this is something that we can continue to offer to the community and the patients even beyond the pandemic at this point.
Now, I mentioned earlier the masks. How are the supplies of the PPEs there?
So a good question. We see a lot of press about folks running out of masks, running out of gowns, running out of face shields. Early on in the process, we were really forward thinking and controlling supply lines and trying to use those in the most effective fashion with the least burn rate of being able to use these up. And so the district is still in good shape as far as the protective personal equipment, the PPE, the things like the face shields and the masks. However, we don't know how long this is going to last. And what we've done is we've enlisted the community to kind of help us out with some of this. For those of us who are old enough for working in the hospital district, we remember the days of fabric masks and cloth gowns.
Yes, we do.
Right? And so those are options for us as we move forward, either for patient use, as we're seeing folks in the hospital to get those essential services, come in for a lab draw, let's put a mask on you. So we're hoping to extend our current disposable, which is the paper versions of some of these products, the masks and the gowns. The ones that you have over there are kind of one-time use disposable ones that are made out of paper. But what we've done is we've partnered with a lot of the quilters and the seamstresses in town, the folks that love to sew, folks that are home anyway that want something to do to help out, and we've called this Project Cover Up. And I've drafted one of our head nurse managers in the operating room, Barbara Stuhan, who's a pillar in the community. If you've ever seen some of her work at the fair, it's gorgeous.
I have. It is
gorgeous work.
Used to be my boss.
Yeah, so
great lady.
So Barb is has been drafted into service to head this Project Cover Up, and as we've got, I think, somewhere around 40 to 60 folks that are churning out these masks and these fabric gowns for use in the hospital district. It's a great example of community effort and community engagement in these kind of rough times.
Now, if somebody wants to join Project Cover Up, What do they do? Who do they
So
contact?
don't call me, call Barb. I probably, if people are interested who aren't part of a quilting group or a sewing a circle that don't know Barb personally, then they can reach out to Barb Lahan at the hospital as our PR person, and they'll try to get you connected.
Very good. And let's see. I just today received this in the mail. It's from the federal government, coronavirus.gov. And it has these handy dandy little
Great information
hints
on the back of this. Now
So
remember,
hopefully we all have these.
yeah, remember these cards are more federal based, so remember that California has a little bit more stringent things for stay in place orders or shelter in place orders, but all of these things are great to continue on. We talked about social gathering, less than 10 people. We talked about eating and drinking outside, right? So no bars and restaurants open in the Owens Valley at this time. But we still got takeout, right? So support those local places that are still doing takeout and delivery, and especially if you're not great in the kitchen at home, cooking with stuff, that's a great option to be able to use pickup or delivery options. Really trying to limit travel. There was a great article this last weekend on social media for some of the folks that frequent our valley. Both enthusiasts with climbers or OHV enthusiasts or fishermen, and a lot of social media going out to say, you know what, hey, this isn't a vacation. Bishop is a small town. Owens Valley has limited resources. Please don't, flood our local resources and take those up. And it's been really effective.
It has been. I was watching today, grocery outlet, the word was out that they would have toilet paper at 8 this morning. Turned out to be later in the afternoon. But last week, lines almost like opening day.
Yep.
And then...
Yep, lines, if anybody has seen some of the photos or the climbing community has done a great job. Hundreds of cars at the Happy Boulders out on Chalk Bluff Road last week. Hardly any travel at this point. I was up at the Buttermilks over the weekend, which is usually a zoo, and I saw like 4 people. So kudos to the enthusiast groups of keeping our valley safer by not flooding down for vacation time.
And the Flash Foxy event was canceled. Shelma Jun, good job.
Perfect. Thank you so much.
She's so smart.
So much for keeping our valley carefully controlled. We've got a lot of students, of course, that are out of school, so studying and working at home is part of that. Tom Boo, the public health officer, doing some great progressive stuff up in Mono County to the north at our neighbors, really enacting kind of some progressive things to keep people at home, to help encourage them at home, and even, fine them if they don't, stay at home when they're potentially spreading virus with a fever and a cough and they show up to work. Great job up there, Tom.
Definitely, yep. We're so fortunate, and it's kind of funny, we're in such an isolated area, and we kind of think of ourselves, oh gosh, the big city, they've got all this stuff going on. But definitely the medical staff that we have up here, yourself included, of course, can't ask for any better.
Thanks.
What's the truth? Get my fat butt alive.
Now, yeah. So, I agree. And part of it is forward thinking. Part of it is just, keeping your eye on the prize and not wavering from that goal of flattening the curve, allowing the resources to catch up with the demand. In all likelihood, Bill, this is going to get worse before it gets better. Mm-hmm. And so, we've got one case now. The doubling time and the exponential growth of this stuff can happen really fast, really quick. We've seen that in other countries like Italy. So I don't want people to have their guard down. That we've got to all be hyper vigilant. We've now got community spread in town. I think it's incumbent for all of us really to double down on all of the things that we need to do so we can keep this under control.
You mentioned the double time, and the social spread is what cuts that down. It was, less than 2 days double time, and now it's up to, in some places, 5-6 days.
Right. Every day we can slow this down means lives saved, ventilators that are available, resources that we can use for people that do normal medical things, right? And people are going to break their legs. People are going to have heart attacks. Mm-hmm. People are going to get, non-COVID related stuff. And so if we can stretch out our ability to handle the normal medical stuff while we're handling COVID, then everybody wins.
And hopefully still the medical people, the medical personnel will be able to stay healthy. That's so critical. That's why the PPE is so important.
Yeah. Part of our focus on getting these workflows together was not just to protect the community and be able to have those resources available for when they need them, but also to protect the healthcare workers that we need to do that. And that's been a main focus from us. It's two barrels in the shotgun.
And of course, when you're at the grocery store, at the bank, wherever, you may be next to an ICU nurse or a ER nurse, doctor, whatever.
Lab tech, a medical assistant, a front desk worker. I've been so blessed to work at the district and to work in my clinic. I'm so proud of my team for doing such a great job at doing the surveillance and the drive-in testing and keeping us all healthy, that we just want to kind of keep up the momentum.
Very good. Now, if you could sum it up in just a few key things. Keep your butts at home.
Yep.
Wash your hands.
Yep. Cover your cough and your elbow, right? Stay away from sick folks. Let your providers know if you have some worrisome symptoms like fever and respiratory things. Stay out of big groups. And then keep your eye on trusted resources for information. There's a lot of difficult scams and internet things and phishing emails and stuff. So keep vigilant. Go back to your trusted resources like Bill here.
Well, and our news director, Charles James.
Charles, yeah.
So, Dr. Stacey Brown, thank you so much again.
Air bomb.
Air bomb.
Air bomb.
Live
Okay.
long and prosper.
Yeah, okay.
All righty.
See you guys next time.
All right.